Today I'd like to talk to you guys about the mental illness schizophrenia. This illness is very interesting to me as I get to see it a lot in the field that I work as a nurse in the ICU. Many people don't understand exactly what schizophrenia is. They believe it is a split personality, but this is not the case. Schizophrenia is a Greek term literally meaning split mind, not a split personality. According to the National Institute of Mental Health, scientists stated that schizophrenia is a genetic disease. They say that if you have schizophrenia, one of your immediate family members also will have a 10% chance of getting this illness at some point in their life. On schizophrenia.com, scientist Eugene Buehler in 1911 coined the term schizophrenia after the diagnosis of the actual illness in 1887 by Dr. Emil Fraglin. So what is schizophrenia? Schizophrenia is a group of psychotic disorders that affect thinking, behavior, emotions, and the ability to perceive reality. The term psychosis literally means the presence of hallucinations, delusions, catatonic behavior, and disorganized speech. We all know what hallucinations are. You can have visual and audio hallucinations. And as I said, schizophrenia is a Greek term literally meaning split mind. So now that we know what it is, let's look at what the symptoms are and how you would recognize it. Eugene Buehler, the scientist that actually gave this illness its name, differentiated the symptoms into two different categories, positive and negative. The positive categories are the much easier ones to recognize. Hallucinations, delusions, disorganized speech, and bizarre behavior, which is the actual diagnosis of psychosis. Hallucinations would be seeing or hearing things that you think are there that are really not, such as voices. Delusion is thinking that something is real but it's not, such as a lot of these people will think they're the President of the United States. Disorganized speech is just speaking in an unlogical sense, and we all know what bizarre behavior is. Negative symptoms are much harder to recognize with people who have schizophrenia. A change in affect, meaning just a change in their general mood that doesn't fit the person. A lack of energy and a lack of motivation. A lot of these people will just completely lose interest in hobbies that they used to have. Now that we know some signs and symptoms, let's look at the different types. There are 5 different types of schizophrenia. However, there are really only 3 that are diagnosed. Paranoid, which is the most common, disorganized, and catatonic. Paranoid schizophrenics, this is characterized by suspicion towards others. These are the people who believe the government is always out to get them. They hear the voices that are threatening them, and they see things they believe are going to hurt them. Disorganized schizophrenics, these are often seen in the homeless population. These are people that are going to have the negative symptoms of schizophrenia. And the last type that is usually seen but is not seen too often is catatonic. There's simply 2 stages, withdrawn or excited. In the withdrawn stage, the person is going to be comatose. This person will not move, they will not talk, and a lot of times they will have to be mechanically ventilated just to breathe. These people will need tube feedings as they cannot feed themselves. In the excited stage, the person can be a danger to themselves or others because they're constant movement. It's like the manic phase in the disorder bipolar. So now that we kind of know how to recognize it and the different symptoms, let's look at how we diagnose and treat this illness. You must have a psychiatrist to diagnose this disease. They will conduct interviews with family, friends, co-workers, teachers, and whoever else is important in a person's life. One thing that has to be present, the symptoms must be there for at least 6 months to have a definitive diagnosis. There are really no tests to diagnose schizophrenia. You can't do an MRI of the brain or a CT scan of the brain. However, in autopsies, it has been determined by scientists that those with schizophrenia do have different brain physiologic characteristics than those who are normal. There are ventricles in the brain, and they say that those with schizophrenia have larger ventricles than those with normal. Also, they say those with schizophrenia have more gray matter in their brain than those who are normal. The way this illness is treated is only by antipsychotic medications. You can't completely cure the illness. One of the medications that is given is Clozaril. That is actually to help the positive symptoms of this illness. The only thing with this drug is you actually have to have your blood work drawn every 2 to 3 weeks to monitor your white blood cell count because it can dangerously cause them to decrease. And then we always want to reorient the person back to reality and tell them their hallucinations and audio are not real. So hopefully you know a little bit more about schizophrenia now, how to recognize it, and how it's treated. And I would just like to end by saying that this is a book about a girl named Lucy who was diagnosed with schizophrenia in her teenage years. And I actually got to meet her at the Moccasin Bend Institute of Mental Health when I was going through my psych rotation in nursing school.